you can make your decisions. Please also know that if, as much as possible, videos and microphones are turned off. And if you have, or please, we want it to be as interactive as possible. So please use the chat box comments. We have a couple people on the team, and I will say it's a great team that are working behind the scenes. So please put your comments in the chat box. We will actually have some fun, and many of you who did take part of the session in September got to use the Mentimeter, and we found it quite useful to kind of get a feel of who's there in this virtual space with us. So if you do have your mobile phone close by, if you're not using it on this, but if you are using if you do have your mobile phone close by, go to www.menti.com. Many of you know this. You see the code here, 669-51868. Please put it in, and we're going to have some questions in a minute. So it's just going to hold that on so you guys can get onto www.menti.com. And if you can just go back, please, yeah, and just make sure that everybody has got that code first. Thank you. And I didn't introduce myself. I was just getting into it. My name is Belinda Abraham, and with Bella, I am the co-lead for the Working Group 7. So we have a packed agenda. We're just going to quickly go through that next. I hope you can all see it in your screen. Good. So we're going to begin with what we're calling an interactive exchange with participants. We will be using the Mentimeter for that. So just hold on to your phones nearby. We will also have highlights and lessons learned of the stock-taking event for the safe reopening of schools, and that took place in September, as I mentioned. Lucy Leclerc from the WINS Network will be taking us through that presentation. Followed by that, we will go back to a little bit of a more global perspective, but then also focus on Africa. And we will have a presentation on the JMP data. That's actually a recorded presentation. At least the voice part is recorded because Christy, who is part of the UNICEF WHO JMP program, is in New York. And as you know, New York is quite early this morning, but she has graciously recorded that message recorded her presentation for us. So we will see that. And then followed by that, we will have both Linda and Christina. We'll go through a study that they've been working on COVID-19. We'll have a bit of a exchange back and then a short health break, and then come back for the country experiences. We'll be looking at Kenya, Malawi, and a recorded presentation from South Africa. Again, at all times, your feedback, your inputs can be put into the comments. We will look at them and we'll make sure we get them as part of this session. And in time to time, we will also open up the mics and allow and welcome comments. We then hope to have a bit of a discussion and exchange. And looking forward, as Bella said, we hope this is part of an open discussion and that these are continued discussions, because as I mentioned before, the advocacy that we have together, the collective experiences, all support advocacies, support inspirations for washing schools, and to support our ongoing efforts to ensure that kids are back in school safely and thriving. So, with that, we will now go on to sort of, I guess, I will talk a little bit through some of the reasons that we find ourselves here. And I'm talking to, I don't probably need to tell most of you this because we've all lived it in some form or another, whether it's through your work, but definitely through your life experiences. So, the COVID-19 in Sub-Saharan Africa has seen probably school closures up to 200 days, and probably the longest were in Eastern and Southern Africa, where about a third of the countries were closed for more than 40 weeks. So we're talking about significant amounts of time where children did not have access to schools. And what the impact we found, and this is coming more from the study, but there'll be more, Linda and Christina will provide more insight on this. But what we found is that there is a huge risk, and we all know this, that the education achievements, all the gains that were made over the decades are potentially lost in terms of many aspects, school dropouts and so forth. We also saw that the sanitary impact in the COVID pandemic has been limited. We saw high socioeconomic consequences, and we actually saw a huge number of deaths. And I think everybody here has probably had somebody affected or knows somebody who was affected and perhaps even lost their lives, and even me personally. So this is something that, again, is we can all really relate to. And I think this is important in this effort in our discussions, that we make sure that this is very grounded in the realities and experiences that we've all gone through. So we've lost the presentation, but I will just continue. So when we look at it in terms of the consequences, you can almost see the consequences in terms of education, social, and economic. We talk about education, disruption of learning, school dropouts, loss of teachers switch jobs, school closures, in terms especially for private schools. In terms of social problems, we've seen teenage pregnancies, challenges with disruption of school meals. This morning it was very interesting. The Water Aid explained how the girls were getting pads in school, no longer were getting pads. So there was a disruption in many of the support services that children received through schools. We also saw and understood the psychological stress and anxiety for this prolonged wave, isolation for many kids, many challenging family situations, and so forth. All of these provided a lot of social consequences to the loss of education. And of course, economic. In some cases, school fees increased. Parents lost their jobs, so economically very difficult. There were an increased number of families who needed economic support. So while we speak about WASH, we speak about the water and sanitation elements, we have to remember the full environment in which this is happening. Good. So now we are moving along. I think, yeah. So we are now, if you have your phone nearby, please go on to mentimeter.com 6695-1868 and tell us where you are coming from. And if you are unable to get on Menti, maybe because you're using your phone, you can also put it in the chat box. And the fine team who's supporting us, Yana, Tina, Lucy, Linda, and also Christina, will definitely put your comments in. Thank you. So we are seeing lots from Kenya, great, Malawi, Ethiopia, Japan, fantastic, Philippines, Zambia, Nepal, yeah, Ghana, fantastic, Netherlands, great, Nigeria, good. So let's go into some of the other questions that'll be coming up in the Menti. So the second question, what type of organization do you work? So please vote. So it's nice to see a nice group. So we have, yep, great, NGOs. Government, yes, research. Education, Ministry of Education, fantastic, nice. A lot of development partners. Very nice. NGOs. So we're having a lot of people who are voting in the NGOs. I'm just going to check the chat box to see if we've got any comments or votes from there too. Let's see. Very good. Private sector, very nice. Education, great. Good. So can we move on to the next? Oh, we're still, next question, please. At this moment in the country where you work, are schools, are they open? Are they closed? I think you should have partially open, partially closed. The majority seems to be. Some schools are closed. Okay. So the majority of schools are open. Fully open, fantastic. Thank you. Good. And if you kind of reflect on some of the difficulties for schools to comply, and we've given you some options, can you let us know what do you think are probably the 3 most difficult things for schools to comply to or comply with? Put on my glasses for this. The text is quite small here. Okay. Okay, so we are seeing here hand washing is there. Water availability is very high. Social distancing, definitely, definitely. Very interesting to see some of this. Yeah, water availability, social distancing is continued challenge. Yeah, good. Distribution or wearing of masks. Yeah, good. Good hygiene practice. So yes, so I would say that generally the social distancing is a challenge because of obviously for classrooms and water availability. Yeah, absolutely, Kaleshi. It's saying that social distancing due to limited space and limited water availability. Yes. And thank you. We've also got participation from Uganda, so great. And happy to have you on board. And the private sector too, and education. Yeah, so I would say water availability stands a little bit, social distancing. I think that's generally the the trend. Anybody from the team who was part of the social, the same in the global, feel free to pitch in as well and compare these results to what you saw in the global event we had in September. Would be also interesting to see. Okay, so good practices. So what would you say are some good practices in schools that you would like to recommend to fight COVID? This one is an open question, and we just like to get a little bit of a view from what people feel are some of the good practices. Good ventilation, and that's very much linked to the social spacing. Investment and access to water and hand wash facilities, very nice, yes. Very much in line with the needs. Promotion of hand washing, group hand washing practice, hygiene, mask wearing, very true. Very effective given the airborne nature of the coronavirus. Yes. Hand washing, wearing mask, social distancing. Alignment with development partners, love that. I mean, that is really a good point because traditional emergencies would have had a coordinated response. And oftentimes, because it's just been so massive, that a lot of organizations are working without this kind of coordination of the response. So that's a very good point. Installation of hand wash. So very much around hygiene, hand wash, investments in water supply, and also perhaps a better coordinated response. Yeah, reducing the number of students in the classroom is also one of the ideas. Class working in shifts. Reassurance and of the importance. Let's see if I can see this thing fully. Yes, of attending school. That is another thing, and that was one of the things that we found is that there has been in some cases absenteeism in school, and so to revigorate, to bring back those messages to families. Many children are working, have gone to work. I know, so there's those challenges too. Hand washing, adequate ventilation, mass hand washing facilities. Yeah, so it's not just 1 or 2 facilities, but the children can do it. Proper disposal, face masks. Very good. Yeah. So we then, yes, and minimum outside contact. Very good. So thank you very much for that. That was really insightful to sort of see where sort of the thinking and the mind is in this. Now then, so we will move along, and I think that has been a nice kind of warm up as we move towards hearing from Lucy a little bit now on the highlights and lessons learned of the stock taking event. And Yeah, and I'm sure, Lucy, you can probably have some reflections from what we just got from the Mentimeter as well. And please, you're welcome. Love to hear from you.
Thank you very much, Belinda, for the introduction. And thank you for giving me also the opportunity to present more in detail the lessons learned and the highlights from the event that you have already mentioned in the introduction. So this was what we call the stock-taking event on safe school reopening and school readiness assessment, which took place in September. We are actually also sharing the lesson learned from another participation in a conference. So that was the Water and Health Conference, the UNC basically. So thank you very much for giving us this opportunity. So I'm Lucy from working to support the WINS Network Secretariat. And before we move to the lesson learned, I just would like to say a word about the WINS Network. Some of you might already be familiar. For others, it might be new. So the WINS Network is a global interagency network aiming to harmonize support efforts and promote alignment amongst development partners and NGOs that support Ministry of Education to improve WASH in school services. It is coordinated, or it is steered by core group members, representatives from UNICEF, GIZ, WaterAid, the GMP, London School of Hygiene and Tropical Medicine, Emory University, and UNESCO. We are working mainly, our activities are around different working streams. I will not go in detail there. You can see them more in detail in the screen. What I would like to focus on also before we move to the lesson learned is to share with you some recent activities that we carried out that might be relevant also in the context of this exchange today. So recently the WINS Network has launched its website, and in this website we are sharing, we are trying to compile all kinds of global guiding documents on WASH in schools. And this is particularly relevant in the context of COVID-19, where it's not always, there's a lot of document coming out, and we hope you can there find what you're looking for. And we have also been working on developing WINS Network publications, so global level practical guides to support COVID-19 responses. Some of those publications, you might have already seen them in the SuSanA websites. Two good one I would specifically like to mention is the knowledge map, WINS and coronavirus. So this one, it's a compilation of global documents, approaches, practical exercise, aiming at different stakeholders, and you have it all in one document. So this is a reference document. Another important one is the 10 immediate WASH in school actions. So this is really a simple one-pager that tell you the main steps for COVID-19 response in schools. All those documents, there's also a checklist, which is also quite good and handy at school level. But all those documents are quite global and needs to be adapted to local context. And please give us any feedback when you're using them. Don't hesitate to contact us. I will ask also my colleague Marge, also working, she's working for GIZ and also for the WINS Network Secretariat, to maybe put the link to those specific documents into the chat box. Another area of activity of the WINS Network is to foster the sharing of experience and the exchange between different countries, between different partners. And this is in this framework that we have organized in the last months, 2 events on COVID-19 response. The first one, the stock-taking event, and the second one I mentioned, the participation at the UNC conference. The first one was organized in collaboration with the Technical Working Group on School Health, Nutrition and Wellbeing, mainly with Asia-Pacific agencies. We had a presentation of South Africa, Ecuador, Indonesia, and India. We also had a presentation from Philippines during the UNC. In total, we have gathered almost 100 participants from different countries. mainly maybe from the Asia region, but still it was an open event for everyone. And as part of this event, we have been asking also similar questions to those from the Mentimeter today. So it's interesting to look at similarities and compare a little bit the results, which I will do in a minute. Before that, maybe some general highlights from the different country presentations I mentioned. What came out clearly is that different countries have had different strategies for COVID-19 responses, and that can go from decisions being made when it comes to school reopening or school closure. And for example, now we saw that mainly in African context, schools have been mainly open. This is also from your response today. In Asia, because we had mainly Asian participants, this was much less the case. There was also there are many different other strategies when it comes to the level of decision making, the mechanisms put in place for monitoring and evaluation. So this is all very country specific. But overall, what came out clearly in those country presentations is that COVID-19 had created a new momentum to really integrate WASH in the core task of the education sector. So this was really coming across. Those different country presentations also have highlighted a number of good practices, and we have there were examples of how those practices and this COVID-19 response has helped increased coordination between the health and education sector. We also have example of how it has helped to accelerate the integration on WINS indicator into the education management information system. We have had example of implementation of school readiness assessments. We also have discussed different levels of monitoring and different levels where monitoring and how the engagement of local government, or example of how COVID-19 response has led to stronger involvement of the local government. Capacity building of school level management, this also at different scale. We had example of what we call MOOC, so massive open online course in Philippines, for example. Examples also of protocols of hand washing on hygiene and different practical solutions for low-cost hand washing facilities, campaign on hygiene practices. So a lot of very practical tools were presented. Also, in some cases, we also had really the overview of the process being implemented in the different countries, from the development of policies to guidelines to much more school level measures. So now moving to the feedback and perception from the event participants. So just putting this in perspective, those are the results of about 100 participants. So this is not rocket science, it's just perceptions. What came out is that in most countries that were represented, there seemed to be national measures that were put in place. So with national measures, we mean implementation of policies at national level, implementation guidelines, so all this kind of national framework. But despite this national framework, schools were still struggling to implement the pandemic preparedness and response measures. So this is what you see here in the graphic on the top right corner. It was still 2.5 out of 5, it was medium, the level of compliance. So from there, we have deduced that there is still really much a need to, now that the national framework is in place, now it's maybe time to look really at the support that can be provided at school level, like really simple school level practical tools and guidelines. This is also in link, for example, with what I've just showed you, publication from the WINS network, like such kind of checklist or capacity building at school management level. Also looking at strengthening the monitoring systems at school level also. We have also asked a similar question as what we just had on what amongst all those different measures choice was the most difficult to implement. And similarly to what we just had today, social distance measures were clearly coming out. And interestingly, water availability also came out, but to a less extent. But what came out also is general supplies. So also hand washing facilities, general supplies, and water were also quite difficult to put in place. When we asked that question, unfortunately, we had not put an answer choice about face mask wearing, but this is now really proven. There is really last evidence that this is really key for preventing the spread of COVID-19. So this is also when you look at measures on which we schools that are important to put in place at school level, wearing of masks, it's really something also very important. We've also asked, similarly as what a question you just had now or so, we have asked participants to share good practices that they've heard during the event that they think are interesting for their country. I mean, replicated is a big word. Of course, we are not the one, our development partners, we are not the one to decide what's replicated or not, but at least what they find interesting from other country examples. What came out is an interest to hear about different measures to empower local government and school management. So this was in terms of monitoring or the use of school readiness assessments. It was, yeah, so this really came out by different people. They also very much appreciated the example of South Africa, that we will also hear today, where basically teachers' unions have been involved in setting up and implementing a school readiness assessment, also on national level, of course in link with Ministry of Education, but the initiative came from the teachers' union. So an interest also on everything to do with school level monitoring and orientation and different training, so the capacity building aspects, and how to engage parents. Of course, as the WINS network, we also had an interest to hear which were the other topics that participants would like to exchange further on, so that we can continue this exchange. I mean, now it's great today that we have this opportunity with an Africa focus, but it's not the final event, and we hope to continue. We have plans maybe next year for webinar series and all, but you'll be informed. And what came out clearly actually is that there are many topics on which people would,
Yeah, we just need to start wrapping up.
Yes, this is my last slide.
Great, perfect. Thank you so much.
So many different topics that people are interested to share on, and we will make sure to take this up as the WINS network. And my final slide is if you are interested to further engage with the WINS network, I would like to highlight the different ways. As an individual, you're welcome to register as a member or take part in by filling out this member registration form. Maybe my colleague Marsh can share this also in the chat box so that you have it at hand. This is no engagement. Basically, what will happen is that you will be part of our database and we will share with you the upcoming activities. And whenever we have an event, we will also do a call so that you can contribute to the different activities if you want, but there is no obligation. At an organizational level, you can become a partner. And for that, you will need to agree with the WINS network vision, which is mentioned here. It's very general. I'm sure we are all in line with this. And then afterwards, this is to register as a partner. So that's it, what I wanted to share with you today and link the purpose of the event. Don't hesitate to get in touch with us. You have the contact details here. You can also find more information on the WINS network website. Thank you very much for your attention.
Thank you. Excellent. Virtual applause to you. I want to mention that you, besides this work that you are doing with the WINS network, you're also working as the regional advisor for the East African Swiss Water and Sanitation Consortium. And I love the presentation because it was just packed full with practical tools as well. And you mentioned also that the WINS network, we can get all of that kind of information. So it's really a huge resource for us in the sector. And so thank you very much, Lucy, for sharing.
You're most welcome. Thank you, Belinda.
Have a great day. And hopefully you can continue with us as we continue the discussion with the country examples. So now we move on to just to see if we're all with us and have a quick insight. I don't know if we can go back to the Mentimeter at all for this next question. Do we go for the Mentimeter question? Can we go?
Yes.
Yeah, let's go to the question. Let's just see how well people are listening. So we're going to have the next question. If you can go back to your Mentimeter. And the question is, what percentage of schools have access to basic hygiene services in Sub-Saharan Africa? And let's see. Let's see. Give a few minutes on that. But you know what I'm going to do? I'm going to let people vote. And if you don't mind, we'll have the presentation and then we'll see how close we get. How about that? Yeah, good. So maybe we lock in. I won't give the answer right away. I think I'll let the presentation happen and then we'll come back to see the answer. And you still, for those of you who haven't got chance to vote, you can still vote. Great. So we go into the next part. Actually, this is going to be a presentation, I believe, on JMP. And we really do want to thank Christy for taking us through the insights on Washington schools. So if we can play this presentation. Great.
Hi, thank you for the opportunity to share a summary of the Joint Monitoring Program report on Washington schools that was released last year, and to provide some insight into Washington schools in African countries. So the third iteration of the survey on national education responses to COVID-19 school closures was published by UNESCO this year. And in this survey, they found that the availability of resources that are needed to ensure the safety of learners and staff, things like soap, clean water, toilets, masks, the availability of these varied greatly by wealth. So in low-income countries, 9% of respondents reported sufficient resources, compared to 96% of respondents in high-income countries. So this is an area where there's quite a large gap. And it's really important for children to not only go back to school, but to go back to school safely. And there's a lot of guidance that's available for how to do this, how to safely reopen, how to operate, such as these 4 documents that you see on the screen. And these highlight how important it is to have hand washing facilities with water and soap, to have basic water services and basic sanitation services. And these very basic services are critical to a quality education, both during the pandemic as well as after the pandemic is over. And this is why they're included in the Sustainable Development Goals under Target 4A. Target 4A says that we want to build and upgrade education facilities that are child, disability, and gender sensitive and provide safe, nonviolent, inclusive, and effective learning environments for all. And the indicator for this target has 7 different services, the last 3 of which are basic drinking water, single-sex basic sanitation facilities, and basic hand washing facilities. And there's a note in the SDG language that says, as per WASH indicator definitions. And what that's referring to is what you see in the colored blocks in the table below. So basic drinking water means that drinking water is available from an improved source, and the water is actually available from that source at the time of the survey. Basic sanitation means that there's improved sanitation facilities such as a flush toilet or a pit latrine with a slab. They're single sex and they're usable, meaning they're available, they're functional, and they're private at the time of the survey. And basic hygiene means that there are hand washing facilities with water and soap available. And the JMP uses service ladders to encourage progressive realization towards these services and beyond. So in the yellow row, this is limited service, meaning that there's infrastructure present, but not all of the criteria for basic service are met. For example, there's a tap for drinking water, but water is not available at the time of the survey. And then at the bottom, we have no service, meaning that infrastructure isn't really available or it's very limited. For example, drinking water is only available from an unimproved source, such as surface water or an unprotected well, or there's no water source at the school at all. The JMP released a document or report last year in 2020 with updated estimates on WASH in schools. This was the second report that the JMP published. The first was in 2018, and the JMP will produce updated estimates on WASH in schools every 2 years. For the 2020 report, a total of 814 national data sources were used. We had estimates for 173 countries. On average, there was almost 5 data sets per country, but data availability is still low for many countries in Africa. And for our next report that will come out in 2022, we're hoping to fill some of those gaps, and we're working on the data analysis currently with a country consultation expected at the end of this year and early next year. If we look at the data that was released in the 2020 report, we found that 44% of schools in the Sub-Saharan Africa region had basic drinking water services going into the COVID-19 pandemic. This is quite a bit lower than global averages. And if we look at the rate of progress globally, we would need a 7-fold increase in the current rate of progress to meet the SDGs by 2030. And the rate of progress in Sub-Saharan Africa is much slower. 47% of schools in the Sub-Saharan Africa region had basic sanitation services in 2019. Again, this is lower than global averages, and the rate of progress globally would require a 5-fold increase in the current rate of progress to meet the SDGs. And we see a similar rate of progress in Sub-Saharan Africa. Only 26% of schools in Sub-Saharan Africa had basic hygiene services going into COVID-19. And this, again, is just a hand washing facility with soap and water available. This is significantly lower than global averages. And the rate of progress globally would need to be increased 4-fold to meet the SDGs. And we see a slower rate of progress in Sub-Saharan Africa. If we look at individual countries that we have data for in the Sub-Saharan Africa region, we find that coverage of basic hygiene varies widely between countries, but many countries have less than 50% coverage. And this coverage varies within countries as well. So on average, urban schools tend to have higher service than rural schools, as you see in the individual countries on the left, as well as the regional averages on the right. If we look at all 3 elements of basic WASH services, water, sanitation, and hygiene, we know it's important to have all 3 of these, but we find lower coverage of all 3 elements compared to each individually. So for example, in South Sudan, over half of the schools had basic drinking water service, but only 13% had all 3 elements, water, sanitation, and hygiene. If you want to dig into the data a bit more, you can go to our interactive data site at washdata.org. You can also download JMP country files for individual countries. You can look at all the different data sources that went into the estimates, any assumptions that were made, and see the data disaggregated by urban, rural, pre-primary, primary, and secondary as well. So in conclusion, WASH in schools was critical before the pandemic, it's definitely critical during the pandemic, and it will remain critical after. COVID-19 is really just shining a spotlight on why WASH in schools is so important. And it's accelerated the momentum to improve WASH services so that we can be prepared for pandemics and that we can ensure a safe school reopening. JMP is currently compiling data for the upcoming 2022 global report. So we're analyzing data currently from all the countries that we can find additional data for, and there'll be a formal country consultation process at the end of this year into early next year. And then those global estimates will be published in 2022. Thank you so much for the opportunity to join, and I hope the rest of the meeting goes wonderfully.
Great, thank you to Christy Chutley, and she is with JMP, the Joint Monitoring Program of UNICEF and WHO, and a member of the WINS Network. And we got our answer there. It is 26%, shockingly low. But yeah, some are sharing that it's even lower in other countries. Kelechi is mentioning 10%. I believe that's, can you confirm that which country? Is that Uganda or for hand hygiene, Kelechi? Peter is saying it's around 25% in Kenya. I would love to hear from other countries just to get a good idea. Nigeria, so 10% in Nigeria, amazing. So this is a national priority, and as Christy said, that this should be before COVID was an issue, but even more so now. Great, so now we go into the next presentation, and I do, again, please keep engaged in the chat box. Please keep sharing your feedback. This is very much to be interactive. Linda and Christina are going to give us a presentation of the work that they have been doing on the safe reopening of schools. And this is not completed work, but they're sharing us. So you're very, very lucky to be sharing us some of the initial details. And they're consultants with GIZ. So Linda and Christina, over to you. Thank you.
Yes, hi everyone. Can you see my presentation?
Yes, we can.
Okay, so yeah, I'm very happy to do the presentation about COVID-19 and the education system and give you some ideas about our results that we got from our desk research and interviews with different African stakeholders. So let's first rather dive into the negative repercussions that Belinda already mentioned in the beginning. I would like to share with you two interactive maps that you can also access online. They have been provided by UNESCO. So the first one on the left side shows you the total duration of school closures. And the darker the blue color is, the longer schools have been closed. And you can clearly see here, especially in the south of the continent, school closures have been the longest with
Linda,
sometimes, yeah?
You need to put the right slide on. We still see the first one.
Oh, whoa.
Okay, perfect.
Okay. So on the left side, you see the school closures, and on the right side, you can see the current situation. And fortunately, and we could also see that by your Mentimeter responses, most schools in Africa are currently open again. There's only this blue spot, which is Uganda, where unfortunately schools are currently closed, and then South Africa, where schools are currently only partially open. Belinda also mentioned the various negative social aspects for especially children and youth. And we just wanted to share with you some of the headlines that you can also all find online and which you have probably seen over the last month and even years. All these rather negative headlines in different countries about teen pregnancies, about school dropouts. There are around 4.3 million school dropouts in Africa, according to UNICEF in 2021. So really a lot of students drop out of school. And here on the right side, you see a press snippet from Uganda, where teachers that worked in private schools didn't go back once the schools were closed and went into different occupations, for example, in farming, because they didn't get any pay during school closures. So yeah, these headlines are infinite. So yeah, really negative. So what did education? What was the response of the governments? Sorry, my presentation here is. So on this presentation here, you see two graphics, which come from a very comprehensive report from the Global Partnership of Education. The first one on the left side shows the basically measures from Ministry of Health that were included in their hygiene guidelines. In the green graphs, you see that there were measures like promoting physical distances and promoting hand washing. These were measures that were basically included in all guidelines, and nearly or even all respondents said that they improved their hand washing facilities that you can see in the blue graph that were 100%. So 23 African countries responded to these questions, and basically everyone included these hygiene guidelines and included these different measures. But what you can see on the right graph is the adaptations to learning during school reopening. And there the numbers are quite lower. And we could also see that in our Mentimeter response a few minutes before, that, for example, adjustments to physical arrangements, that is the first blue graph with 48%, is not possible for many African schools. And so only half of the respondents could really say that they could really adjust the physical or adjust the classrooms accordingly, even though in most of the guidelines they promoted physical distancing for the students. So unfortunately, guidelines and reality is not always matching. Yeah.
Yes, so as we heard, schools were closed for nearly 10 months since mid-March, and one response to animate parents and students to go back to school was the back to school campaigns. And we can see here that an example from Ghana, we see that they had like a multi-level campaign which included videos, radio messages, posters, as you can see here, and then also like little clips and community outreach. Linda, could you click once more? Yes, so they're on Facebook and social media. We could see all different kind of aspects to try to animate people to go back to school. Next slide. Yes. So when we did our research, we talked to some of you that are in the meeting right now, and had very different impressions. We collected here a couple of challenges that you named yourselves. So, for example, we talked to Irene from Uganda, and she said in the case of northern Uganda, a bigger percentage of teachers are not computer literate, and because most of the guidelines were shared as soft copies, they did not receive them. So that's an aspect we found very interesting. So there need to be hard copies as well, because in some areas there's just not the access to computers. And then Justina Pereira, she said the government insisted that people wash their hands, but where I am, and this is in Kitui country, in Kenya, there's just a scarcity of water. Next one. And then Yashin Wamanga, he said, as we speak now, some of the privately owned schools have been turned into guest houses, poultry houses, and others into restaurants. So we see they're not even schools anymore. They have been transformed into something else, which is quite, so people can't, there are not enough schools and people can't go back because they've been transformed to restaurants. Next one. So our Belinda Abraham from our moderator, she said the awareness of WASH improved. It became more of a national than a sector priority. I think, Belinda, you will talk about this some more when you talk about Kenya. Next. So Catherine said, we used to be very NGO driven in the area of WASH. Now it is the teachers and the parents and the government who really take hand washing into their hands. So this is also very interesting, that there is a momentum where the focus shifts. Next one. And then Anna Douglas from a Ghanaian NGO, he said, after the pandemic, washing our hands will be part of our social life. This will also be prevention of other diseases. So these can be taken as positive developments. Linda, can you click and take me to our last slide, recommendations that we collected and thought that we could share here to discuss later. So the main points, I mean, you are all familiar with these issues, that there's not enough infrastructure and not enough resources for infrastructure. So this is really something that needs to be there for safe reopening of schools. And then another point we wanted to make is that promoting hygiene management in schools with checklists, cleaning protocols, and monitoring is something that without it, management and monitoring, all the facilities and all the infrastructure need to be managed and monitored. Also, some of you said joint task forces of officials, teachers, and parents and health clubs really helped. So this is something that could be kept up. And then last but not least, enforce school reopening guidelines even when COVID-19 cases drop. So even though that the imminent threat is gone, we should use that window of opportunity to lobby and advocate for WASH in schools. And that takes me to the end of our presentation, and I hope we will have an interesting exchange later on. Thank you very much.
Great, thank you both, Linda and Christina. Yeah, I think one thing that comes, and I would love to hear comments in the comment box, or if you want, raise your hand to say a few words. But I think what it underlines for me, and I think all the presentations we've listened to this morning, is the challenges that are faced are not new in many cases, especially around the water and sanitation, were things that were before. But now they're compounded. So you're not only doing WASH in school, but you're in a compounded situation where you're dealing with all the other issues. And that makes even water and sanitation even more challenging to implement when you talk about government budgets, when you talk about teachers' attention and teachers' time and everything else. There's a hand raised. If we can unmute Kelechi, from Nigeria, to say very briefly, or maybe you can put it on the chat box, if it's possible, if you can, just to put your points in. So if we can, because we are kind of running behind, but if we can, please put your points in the comment box. And I will leave it up to the administrator. Yes, thank you. I think it's because of the time. Sorry, Kelechi. But if you can put your comments in the comment box, that will be great. So I think would love to hear some reflections. Perhaps maybe I draw in Bella. I know, Bella, you've been quietly listening. Can I call you back in? And also maybe perhaps Tina, on some of your reflections. And I would love to see the comment box with some reflections from other participants. Bella, please.
Yeah, I think it mirrors very well also what we heard this morning. The whole situation calls really that schools are not, I think what came out so clearly is schools are not just for learning, and all the efforts to let children learn at home and to have digital school and have all of this will not really address the real problem, that schools are sort of safe places for children. There are a lot of services offered for children, and that there's no way around of opening schools. And there's also now no way around to really see what needs to be done to improve the situation. So I think, and that is, it's also interesting to see this is affecting all countries in the world. You even heard that from schools in Europe, but of course the problem in Africa is far bigger problem. But you can also see that the willingness to open schools is also greater, and there's also far more support need. Yeah, so I think it's so good to see that the education sector gets pretty clear that schools are far more than places to learn. Yeah,
absolutely.
So, and that's something
setting their systems, and they are supporting whole communities. And I think one interesting comment comes from Agnes. She's saying the challenges about reinforcing school opening guidelines, because there were a lot of guidelines done by WHO, UNICEF, and national guidelines, but the challenge of enforcing them at the school level, and it goes back to some of the challenges we've had previously in just enforcing school wash wins. And what do we need to understand how, for example, wearing masks and so forth to see cases drop. So what about some of those issues around enforcement of national guidelines, implementation of national guidelines, monitoring of the activities? What are some of your reflections there, Bella?
Yeah, perhaps briefly, what in what I've seen, the experience with this is the monitoring is very much also guiding the direction of what needs to be done. So monitoring is far more than just measuring progress. Monitoring is very much also giving orientation what need to be done at school level. So I think many countries have worked a lot on, for example, measuring the readiness for schools if they're open and so on. That helped a lot to create also orientation and awareness what needs to be done. And I think that's something to embark further on. And I think, yeah, I have the big hope. It was all, I mean, the crisis and the pandemic had huge impact on all of us. And we can just hope that the light it sheds on washing schools will also help to improve the situation. So, and that's something, and we're monitoring and shedding a light on the huge need, and what you showed there, that only 26% of schools in Africa have adequate hand washing facilities, and the basic service level is very, very low. This is not really sufficient to comply with the standards which is required. Yeah, so
and in some cases even 10%. Like this is talking about national, so you can imagine with inequities in communities, this is probably in some places even less. So it is a huge challenge. Thank you, Bella. So now we're going to go on to our next, again, to get more of a bit of a country overview. And we're going to look at Kenya. And if the team can put up now, it's a quick video, and I'm going to introduce it as we start the Kenya presentation. It's a quick clip from Al Jazeera. Let me see if we can just get the presentation going. So maybe the next one, let's just go on to show the clip. Just to, next one, yeah. Yeah. We're going to go just a quick clip of the reopening in Kenya. Please go ahead. Thank you. I don't hear the, you need to put the sound on for us. Thanks.
Nairobi's Ayani Primary School line up to receive face masks given out by the government. 18 million students have returned to school across the country after a 9-month disruption caused by the COVID-19 pandemic. But many say conditions at the schools are far from ideal.
We have very few water points, and therefore, as you can see, the children have been struggling to wash their hands. And using this one water point here is not easy.
Without more desks or classrooms, the children have to sit shoulder to shoulder, 3 at a desk, just like they did before the pandemic. Teachers are warning that the often overcrowded and underfunded schools are ill-prepared for reopening in the face of the ongoing pandemic. They say there have been no new provisions to ensure that there is social distancing in the classrooms. Parents too are concerned.
At the moment, we have got a lot of fears because we really don't know if other children in school are having the virus, or even if the teachers are having the virus, or even the support staff in school are having the virus. So we have that fear, but we really hope for the best, and we shall keep on praying for our kids to be safe.
COVID-19 cases in Kenya began surging in October and peaked in November at the rate of 1,972 cases per day, according to the Health Ministry. Despite limited testing for COVID-19, the country has recorded 1,685 deaths and almost 100,000 cases. Many are now worried the reopening of schools might lead to another surge in the number of infections. Mohammed Adu, Al Jazeera, Nairobi, Kenya.
Wer macht
Great.
Do you follow this?
Thank you very much for that. And I see some messages here that, yes, the situation, it's really, I think I'm just going one, the major concern about the inability yet to show. This situation is quite challenging. So now we're going to take a little bit of a diversion from the planned schedule. We were supposed to give a break, but we are running a bit behind, and we do know people are super busy. And there's a lot of people waiting to present and to share. So we're going to continue along. I'm going to kind of guide the next discussion. It'll be a quick one. And I know there's a number of participants from Kenya. So I do want to invite perhaps Agnes Mekani, if she can be unmuted, as well as Norbert. And I'm not sure if Welema is with us, if they can be muted. So if you are from Kenya and either from Ministry of Education or Ministry of Health or UNICEF, please raise your hand so we can make sure that you're unmuted. And as I go through this presentation, and I will invite you to say a few words. This is not a traditional presentation, it's more or less a reflection from the country. So, great. So can we go to the next slide, please? Move. Yes, we've seen this. Great. So as the presentation has highlighted, some of the government procedures or support was really around the school protocol guidelines, which were established by Ministry of Education. They encouraged the school latrine ratio. They mandated hand washing in all the classrooms. There was even the provision of pads, provision of masks, and also allocation of funds for some schools. However, as we have seen, the challenges in the schools, the challenges still remain for schools. So I would at this point like to invite perhaps a representative from Ministry of Health, if we can have Norbert. Are you with us? I don't see. Yeah. If you can.
Thank you.
Yes, Norbert. So you are calling from the counties. Can you give us a little bit of an impression of, you saw this video, how much does that reflect the reality of where you are in the counties, the subnational level, visiting schools? Can you give us a bit of a reflection?
Okay, thank you, Belinda. My name is Norbert Msundi. I work in Trans Nzoia County with the health department. I want to appreciate this meeting because it's bringing to that you people have found on assessment, which in some way are also consistent with whatever we found. So during the reopening of schools, we had so many challenges, but we had to work hand in hand with the Ministry of Education officials so that we carry out the school assessment for preparedness And we had a checklist that was shared by the national office. We went around all the schools and we were able to, like in Trans Nzoia County, we were able to get the status before reopening. One thing that we realized was that there was a challenge of water in some of the schools, and we encouraged the school management to see to it that have a system where they can get water in the schools. The issue of face masks was also a challenge. You know, in some of these rural areas, access to face masks and even the cost, some parents could not afford. But I appreciate UNICEF and other partners also came in handy and supported the face masks. The issue of social distancing, you realize that the first phase was for grade 4, 8, and Form 4. And by then, there was some bit of social. In January, social distancing was a very, very big challenge. I want to appreciate also the Ministry of Education. They were able to sensitize the teachers. You know, since the schools closed, teachers were at home. And I remember at one time the health department were overwhelmed. And in one of the meeting, we were really calling upon teachers because you realize that the number of health workers vis-a-vis the number of teachers, the health workers were less. And at one point, we had requested the county commissioner to discuss with the CDE and TSC and see whether we can also look the teachers, but lucky enough, the schools opened. So that partnership really assisted, and the sensitization of the teachers really assisted. And when you used to go to the school, you find that the teachers also are informed about some of the prevention measures. Most of our quarantine facilities sites were in schools, and that really assisted us because at the beginning people really panicked, and as health workers we were to provide direction and information. But I appreciate the department and all the other key players and partners in the county. We came together, sat down and discussed how to go about it. The directive from the ministry was also handy, especially that one barring people not to access schools during the initial opening stages. And I know it had some challenges because most teachers were coming from outside the school, but we had these facilities at the gate whereby all the measures were being taken, the temperatures, hand washing, and some brief history about where the teacher or the worker comes from. So I want to say that going forward, we need to, at that time also, when schools closed, our girls, you remember the sanitary pads were in schools?
Yes, Norbert.
I appreciate the Ministry of Education organized and yes, the Ministry of Education organized and went ahead to call the girls pads in schools, which was a big boost to our girls because you know most of these people depend entirely on pads in schools. So to me, I'll say that going forward, we need to forge a united front in the fight against COVID. And the gains so far made, we need to sustain them.
Absolutely.
Thank you for now.
Thank you, Norbert. That was excellent. Thank you very much for giving us really a local view of the challenges. And I do like the point when we talk about hand hygiene, we haven't been talking about hand hygiene, but the fact that girls were, and I think it was also mentioned in the International Learning Exchange, girls were regularly receiving menstrual pads, as you mentioned, and this break in school. And so the government to reinstate this was very, very key to bring girls back to school. So if we can go on to the next slide. Thank you very much, Norbert. The next slide, please. Yeah, so in the next slide, we've talked a lot about the situation of Washington schools in Kenya, and I'm showing a little bit of statistics here from UNICEF, and I'm just going to quickly, and Agnes, we're kind of very short in time, but if you wouldn't mind sharing some of the challenges on getting information on Kenya and Washington schools, and perhaps maybe looking forward, what are some of the things that needs to be done in Kenya around the existing situation. So do you mind saying a few words, Agnes?
Yes, I can hear you, Belinda. Can you hear me?
Yes, perfectly fine, like we're together. Great.
Thank you very much, Belinda, for this opportunity, and also for GIZ for organizing that we hear what we have been doing on safe reopening in Africa. So we really appreciate and we look forward to participating in the larger forum. In terms of availability of data in Kenya, when COVID struck, in UNICEF, we formed a committee which was working on safe reopening of schools and advocating on the government to be able to reopen schools. And we even went to the level of advocating with the Cabinet Secretary, Minister of Education, and Ministry of Health on what they could do in terms of reopening of schools. And one of the challenges which he had was the data, which was required to help us understand the current situation of wash in schools, because now COVID made it very key that children practice hand washing in schools. And so with this committee formed, we were tasked, I was tasked at UNICEF to bring on board Ministry of Health, Ministry of Education and Ministry of Water to prepare also the protocols and guidelines on what would we look at when we are assessing in the schools, what would be the minimum checklist. So we worked together and prepared a minimum checklist, which was looking at the basic requirements. And I'm happy with what Lucy presented on the 10 actions to follow when we are developing guidelines for the country. And that is actually what guided us to come up with the checklist and the minimum requirements in the area of water supply and availability, the sanitation facilities, and washing facilities, the supplies, waste management, and also not leaving out menstrual hygiene management. So for us to be able to bring on board all the partners, or to tell the Cabinet Secretary this was the dire need in the schools, then we require to have data to be able to know what is the situation in the schools, how many schools have access to water, how many do not have, how many have hand washing facilities. So we went to the Ministry of Education, the name is data, National Education Management Information System. And that time the data was not ready, but we were referred to the NEC, or the Kenya National Education Examination Body, NEC. And when we went there, we were able to get this data, which was for 10,000 schools. They gave us the raw data, which had been collected to check on the preparedness for the new curriculum, the competence-based curriculum. So we worked with NEC and analyzed this information, and this is what was able to give us some idea or some data on schools with totally no access to water. Some schools with access to piped water, you can see only 32% had access to piped water. And the challenges we had on that data was that it could not tell us on functionality. Are the toilets usable or not? Are they private or not? What type of latrines do we have? And then in terms of water supply, is it available at the time of the survey? So that was actually limited access to safe water, and then totally no data at all on hand washing facilities. So we had to rely on a survey we did in one of the counties in Kitui. And in these counties, the data had been done with Oxford University. And this gave us an idea that around 50% of the schools had access to hand washing facilities. And so we use this data now to estimate that in the counties, over 50% do not have hand washing facilities. And we use this data to do a costed action plan to Ministry of Education to show how much we will require to meet 50% of the schools in Kenya with hand washing facilities. And then we also estimated the soap required, and also for those who did not have water at all, how much it would cost, and the sanitation blocks. And we shared this with the Ministry of Education for their further action on that. Thank you. Over to you, Belinda.
Thank you, Agnes. That's excellent, because it shows clearly how you were able to go from taking the information, then to cost it, and then to make an advocacy piece for investment in this area. And I think that is very, very key. So thank you so much, Agnes. And as well, UNICEF and partners has supported the ministry for a number of enabling environment things to support the enabling environment, as you see here. And all of these, including the recently designed, which I was very honored to be part of, the National Wash Strategy. So if we just go on to the last slide, I would quickly go over this, and perhaps, I don't know if there's anybody from Ministry of Education because I'm unable to see the screen. If you are from Ministry of Education in Kenya, please raise your hand just to talk to us briefly about the enabling environment and what are some of the key components that you see that need to be moved forward. There may not be somebody, but I just want to give some time. Is Walema with us?
Anybody? I think like Walema had joined and Florence.
Oh, okay. So maybe if we can open up Florence, you're the director. Can you maybe have a reflection on the reopening of schools and what needs to be done in the case of Kenya moving forward on behalf of Ministry of Education or from an education perspective? And we saw the school feeding too. So this was also a very key part of the reopening of schools. Florence or Walema? You're welcome. Perhaps maybe. Okay, so as they're going, then we just to say that the national strategy has 6 building blocks which are aligned with this SWA building blocks, and these are being very, very critical to ensure the implementation of WINS. They are, as you can see above here, the enabling environment, dissemination of documents, guidelines, policy, institutional arrangements. How do we work between Ministry of Education, Health, Water and Sanitation, Irrigation. Also financing and budgeting, which is very, very key. Capacity building, teacher training, and then overall principles of sustainability, monitoring, evaluation, which Agnes has well explained. So going on to the last slide, the future focus. So I wanted to actually give this space to somebody in Ministry of Education. Are we, maybe somebody from the administrator can tell me, is there anybody from Ministry of Education raising their hand? I can't see from my screen. Maybe. No, nobody from Ministry of Education. Okay, so maybe if I can just quickly invite somebody from Kenya who's spoken already, if you just quickly want to say something on the future focus. What needs to be done, what is being done. I think, Agnes, you articulated it very well with the needed investment on water supply for schools in order to do hand hygiene. Would you like to say anything else? Also open it up to Norbert as well from the county. Just what do you see as a future focus for Kenya?
Thank you, Belinda.
Yeah,
yes, further to what I have mentioned about the infrastructure, I would say that the enabling environment in Kenya has a lot which has been done in terms of developing policies like the School Health Policy, Menstrual Hygiene Management Policy, Basic Education Act, and also guidelines and strategies, as you have seen in that slide. So I would say one of the priority areas on this strategy of future focus for Kenya is to disseminate the policies we have and the strategies such that they are implemented and we realize the impact we have in the schools. Like the strategy clearly outlines the 3-star approach, which will help us nationally to be able to target and reach the schools, to be able to bring about their own initiatives in terms of improving their wash status and also rewarding and recognizing the efforts from various schools. So the dissemination and these documents is very key because we have many of them which have been done. So I would say that is one of the areas we need to focus on. And then, as I mentioned on data, the area of monitoring and evaluation, for us to be able to advocate well for budget allocation for washing schools and also prioritization with the government, we need to present the evidence. So in terms of strengthening the data available and the information available on the status of washing schools is very important, and we are working very closely as UNICEF with the Ministry of Education to see how washing schools indicators can be integrated in NEMIS, and we are planning for a workshop already. A tool has been developed to be real-time monitoring, and a workshop will be organized in this month of November on how to integrate these indicators so that all the time we have a real-time monitoring system to be able to update the data we have on washing schools. And there's a dashboard which the CS can use and say, this is the status on washing schools, and this is what we need from the government, even to improve the infrastructure and the software, which is how we implement these protocols in the schools and how we educate the teachers to impact the right information and knowledge to the school children. Thank you. Over.
Oh, thank you, Agnes. This has been so excellent. And I think you've raised there's quite a lot of back and forth on the chat as well in supporting this. But I do think that Kenya is taking a very systematic approach and taking it through the monitoring and looking at the data and using that to build evidence for investment and actually actions and interventions in schools. So thank you very much for that. And now we'll go to Malawi. And I'm pleased to invite Thomas Kanjodo. So Mulibwanji Thomas, welcome. Zikuma Kambieri that you're joining us. Yes, and he is working with the basic education program with GIZ in Malawi. And he's a seasoned educationalist with more than 20 years experience in the education from early childhood care all the way up to tertiary level. And so this is great. He's currently managing the disaster management response component of the public teachers in the public teacher training colleges and teaching practice schools in Malawi. And he's the lead person for the implementation of the Fit for Schools in Africa. So welcome, Thomas Mulibwanji Achemwene. Looking forward to hearing from you.
Thank you so much, Belinda. Thank you so much. Thank you so much for according Malawi a chance to make a presentation on safe reopening of schools, our experiences. Next slide, please. Next slide. So in Malawi, COVID-19 had a very negative impact, such that the president declared the state of disaster on 20th March 2020. And because of the declaration as a state of disaster, then the government of Malawi directed that all learning institutions should close on 23rd March. And this was just 2 weeks before the closure of the term. And meaning that the learners in the institutions did not even sit for the end of term examinations. I've lost the presentation. So
sorry, Thomas, give me 1 second to put the presentation up.
All right. Yeah, so then after that, the Ministry of Education developed a preparedness and response plan. And the idea was to ensure that the still continuity of teaching and learning during the closure of schools through already established mechanisms like radio programs, online learning, and also intensifying the awareness raising and behavior change for prevention and management of COVID against our teachers, learners, and communities with support from the development partners and the government established clusters. So within that, then the NGOs, the government, and other development partners were there to promote the safe learning environment for learners and the teachers, and also to strengthen coordination with other clusters. So I've really liked learning from other countries that there's that intercluster coordination for health, wash, education, protection. This also happened in Malawi, and that was part of the preparedness and the response plan, which was developed. Next slide. So from 23rd March 2020 up to 7th September 2020, the schools were remained closed. So on 7th September, the government directed that all schools now can reopen. And that was after it was noticed that the number of positive cases had decreased, and also the government had actually done some assessment in terms of preparing the schools to reopen. So prior to the opening of the schools, the government developed the guidelines for safe reopening of schools, and within the guidelines, they had a checklist, which I've also liked from other countries where, like Kenya, they also had the similar checklist where the government did the assessment in terms of the readiness of the schools. And the assessment of the readiness of the schools were actually focusing much on the wash-related facilities, but also in terms of the safe environment. And before the opening of the schools were also disinfected. So all the schools were disinfected to ensure that they were safe environment for the learners. And the government and the other partners who supported the education cluster provided minimum wash packages. And this meant they provided 20-liter pails with the lids and taps, and also another 20 liters pails without taps, and provided with the soap and also chlorine. And because of the assessment that was conducted, it was realized that 460 primary schools out of about 5,000 primary schools had literally no source of water. It meant that when schools reopen and when we want to improve, to promote safe hygiene or safe frequent hand washing for the learners, these schools would remain closed. So the government started a project on drilling of boreholes to these 460 primary schools and the 200 secondary schools. But as you know that the drilling of boreholes takes longer. So that's why, as a short-term measure, the government provided and other development provided the buckets, plastic buckets, which were used. And in such instances, the mother groups in the schools and the school management committee members, they are the ones who were fetching water from a distant source of water, bring them to schools. And they were monitoring the use of water. When the buckets have run out of water, then they would go back and also get some water so that there is water available for each and every stream within the learning institutions. And the government and the other partners also built the capacity of different school structures on how to support learners and teachers during the pandemic. So on this one, the government trained the mother groups. The government also trained the school management committees in terms of making of face masks locally, which will be distributed to learners within their school, the learning institutions. Next slide. Jana, next slide, please. So much as we are talking about the school reopening, we have still some difficulties in ensuring that the school remain open. So one of the issues of the shortage of classrooms, absence of PPEs, hand washing facilities, these were some of the things that made the school opening a challenge. And the other issues were also in relation to ever-rising the number of COVID-19 positive cases. So let me also mention that in Malawi, communities, they had exerted much pressure to the government when they realized that the schools were closed for quite a very long time. And after that, what they did was pressure the government to reopen their schools. But at that time, there was still ever rising number of positive cases on a daily basis. And the government said, no, much I want to balance the right to education, we also need to balance that with the right to health. And also shortage of hand washing facilities in schools. The government wanted to ensure that at least the wash-related facilities, the status is improved in the schools. And through that, that's why now they had to start drilling the boreholes to ensure that the water is available. And the other challenge was large class sizes, as you can see from the example. So that's one class of learners, which are from that you'll find that maybe there are over 200, like in one class. And that meant that even if the government says schools should open without putting much measures in terms of how to reduce the class sizes, that remained as a challenge. So large class sizes, fewer classrooms, because the government needed to like divide the classes maybe into different streams to ensure that now the classes are reduced. And that also brought an issue of number of teachers. It meant that it required some more teachers to support the additional classes for the same class. Like, for example, if it's a standard 4, it meant maybe it will be now divided into 3 or 4 extra classes, which required 3 or 4 extra teachers. And this also meant that they wanted to reduce the pupil teacher ratio of 60:1. And this had some difficulties in ensuring that there's to maintain the physical distance amongst our learners. And the other difficulty that we had in Malawi, I don't know about the other countries, it was misconception about COVID-19 virus and vaccination, such that most of the communities around, they thought that one COVID-19 was only for those who are rich, for those who are in the cities, and the others, they said no, COVID-19 is part of Satanism. And those who, like, for example, when they started talking about vaccination, those who get vaccinated, then they will be like being part of the 666, the biblical aspect of the 666. And whenever they saw a vehicle passing by their school, most of the parents would actually run and come and grab their children. They thought that they will vaccinate all the children. And the other parents, they thought that the vaccination is part of population control, so that those who will be vaccinated, they will not bear children. So such misconception required the Ministry of Education and the Ministry of Health to do quite a lot of sensitization within our learning institutions. Next slide. So what are some of the government initiatives that ensure that schools remain open? So one of the things is they are continuing to drill boreholes in schools, and also construction of group hand washing sessions in some sector schools. As you can see, that's an example of work.
Yeah, you just a minute left, please. Thank you. It's a very interesting.
All right. Yeah.
Thank you so much.
Yeah. So I'm almost there. So the government is with other partners. They are constructing the group hand washing facilities in some schools, and also construction of low-cost classroom to decongest the classes, and the provision of tents, which are used as the isolation centers for teachers and learners diagnosed with the virus. Next slide. So for GIZ, we are, as you indicated, we are also implementing the Fit for School initiative and working with the TTCs. Why did we choose to work with the teacher training institutions? It's because we want to build the capacity of the in-service, the student teachers who are still in colleges, so that once they grab the information, the skills, the knowledge, then they will transfer that to the teaching practice schools, where they will also translate to the learners, who will further translate the knowledge and the skills on WASH-related issues to their parents. So with the Fit for the Schools, we'll be providing awareness-raising materials, and also will install the hand washing facilities at TTC level, so that the student teachers should learn at that level, the public teacher training colleges level. When they go to the teaching practice schools, they should also do the same with their teaching practice schools. So it's like we will have an effect or an impact within a short period of time with a very few resources. Since fewer learners, for example, 4,075 students going to about 800 teaching practice schools, which will translate to a lot of learners getting the skills and information about WASH in schools. Thank you so much.
Thank you, Zikomo Kwambiri. That was a really great approach to work through the teachers and having then these exponential outreach. So thank you so much for very enlightening, and also probably when I see that picture of that classroom, very troubling to see so many children in that classroom, and you might imagine the challenges of water and sanitation, just even teachers to manage such a situation, and then compounded with COVID. So thank you, Thomas, for highlighting the challenges, but also the way forward in Malawi. Great, so as we then move on, please, any reflections on Thomas's presentation and other things, please share them on the comments. We go on to the last presentation, which is actually from South Africa, and it's a recorded presentation. And it was done, if some of you had the opportunity to join the Safe School Reopening open discussion in September, you heard from Mary Metcalf. And Mary Metcalf is the head of the School of Education in the University of Witwatersrand. For those people who are Dutch or Afrikaans, excuse me, I can't say it so well. But she is the director of the Department of Higher Education, and she's actually currently also leading something called PILO, which is a program for improving learning organization, and also working with the National Education Program or support, so NPO. And she's working in several provinces in South Africa. And in her presentation, she talks about the importance of teachers. So we're moving from Thomas's focus on teacher training and teacher training practice for WINS, but also looks at how teachers' readiness is key to ensuring implementation. So can you play that, please? Thank you.
Thank you very much. I am very happy and learning a lot from the presentations that have been made. My presentation is a little bit different to, for example, the last one from Harris, which looks at what government is doing to monitor, because this one looks at what the teacher unions have done with surveys to look at school readiness to open. I'll explain what was done and why. So just very quickly, there's several key factors affecting school closure and opening. One is the national state of regulations in terms of lockdown. And the second is a very important one. It's both school readiness as well as confidence in the public about school opening. So clearly school readiness is a factor in opening. Now, in terms of the extent of school closures, the first presentation by, the first presentation was fantastic in looking at the extent across internationally. In South Africa, it's difficult to say precisely how much school were closed, but in 2020, 54% of school time was lost, but there was great variation by grade. We prioritized the last year of secondary schooling, the last year of primary schooling, but some grades lost as much as 6 months of schooling. Now, the urgency of keeping schools open has also been well articulated. In South Africa, there are huge challenges, particularly for the poor, of learning at home. So keeping school closed and learning at home is not a viable option. But there's also, as was explained in the first presentation, huge benefits in terms of socio-emotional support and school feeding. And then another way of articulating what was said earlier is that, while I took a position, the unions took a position, that schools can actually function as a barrier to transmission if they're properly resourced and if they're properly managed. So the union surveys were done basically as a model for collaboration and triangulation with what government was suggesting was in the place. Our systems are not as sophisticated as in Harris's presentation, so there's a lot of compliance reporting. So the unions did the surveys and were able to do comparative analysis, disaggregated geographically and looking at progress over time. as a basis of discussion. Now, the unions, it was a very powerful reach to all of our schools because we used WhatsApp and we used a technology platform which was a very quick survey. There was no verification, so there were limitations. But we reached in the first survey 40% of all schools in the country, so it was a sample. And that's because the unions represent 95% of teachers in the country. We got the principals to submit. Now, one of the analyses that we developed that I think is quite important in terms of understanding what we mean by readiness is there's a difference between material readiness, institutional readiness, and teaching readiness. The institution has to have the systems in place based on having the correct material, the correct PPEs. And actually one can't assume that because there's material and institutional readiness, that teaching readiness automatically follows. There's particular work that needs to be done as educators to be ready. So the material readiness is as you would expect. These were the questions that we asked schools when they were preparing to be ready for the different grades when they were returning. And we also looked at it in terms of this is what it was 2 weeks ago. The progress has been made. Schools are now ready. So those are what you would expect. It's what you've heard. Aligned with standard operating procedures, aligned with World Health Organizations. There's two that I've put in italics at the bottom because readiness also requires community readiness discussions with governing bodies, and you need a supportive bureaucracy that's talking to principals and giving them guidance. So we included as the line manager, the circuit manager in touch, and are you talking to your school governing body, which is a vital link to community. In terms of the institutional readiness, you'll see that this is very subjective. We're saying, do you have enough confidence that you have the materials now? So it's a sequential next step, but do you have the systems? Because there's huge institutional management shifts in managing what has to happen in schools. So are you confident that you can clean classrooms twice a day, that you have systems to wash hands when children enter classrooms? Have you got systems for drying hands with paper? And again, in terms of institutional readiness, is the principal communicating with parents? Because parents also need to be ready. And then with teaching readiness, because of the time lost, the curriculum guidance needed to change. And then we asked principals, have your subject teams or your phase, like foundation phase, early grade, met to review the guidance? Are you planning for work at home? Now, just to quickly look at South Africa and to look at the important principle that's come out in earlier presentations of poverty and readiness. So South Africa has 9 provinces, and I'm focusing on only 3 provinces, Limpopo, KwaZulu-Natal, and Eastern Cape. And why I'm focusing on them is that in this poverty map, where blue represents low poverty and red represents high poverty, you can see that there's large sections of the country which are much more blue and others which are much more red. I'm looking at Limpopo, which has 16% of our schools, KwaZulu-Natal, which is 24% of our schools, and Eastern Cape, I can't see because my screen is covering that, but it's about 16%, I think. Now, those 3 provinces have the majority of schools in the country, and they are also the poorest. So the disaggregation in our analysis between provinces becomes important. Provinces are the main drivers of the education delivery. That's where teachers are paid, that's where material is bought. So let me just give you an example of the kind of data that we were able to produce. The kind of data that was shared with government at national level primarily, but also at provincial level, and which the teacher unions were able to use in their public communication with their members and also with the media. So the analysis that I'm going to give you is by color coding, as everybody does these days. I made these to be readiness below 50%, readiness between 50 and 80, and readiness above 80. Arguably, those could be different, but it was a useful tool of analysis. So this is the one page of the survey results for material readiness. And it was on the 5th of June last year when we were, are we ready for grades 7 and 12? What is important is that you can see some key material challenges nationally. And I want to look at water. So water, only 2 provinces, the wealthier provinces of Gauteng and Western Cape, had adequate water. The rest of the 7 provinces only had between 52% and 75% readiness in terms of water. That is a huge challenge. In all provinces where there is not water at school, we also looked at were the water tanks delivered. We'll come back to that. The second thing is to look at the provincial variations. You can see KwaZulu-Natal was below in 80 on 7 measures. Eastern Cape was below 80 on 10 measures, and Limpopo was below on 5 measures. So those 3 provinces, representing 62% of the schools, were the least well served. So as a country, the challenges are to do material inequalities, the differing capabilities to support schools. A very important thing, I think, which is underestimated, is the protective measures, because the science changes and we overestimated physical over airborne transmission. Cost of PPE took away our infrastructure budget. Learning loss was the greatest with the poor. With the unions, the challenges was survey fatigue. And I think that the challenge is always maintaining something that I'm passionate about, which is government-union collaboration. Thank you for letting me finish on this slide, because I think my time is up. The key learnings are 2. Continuity of education is critical, that point's been made. But the other thing that I think we underestimate, school leaders can solve problems we haven't even imagined. Thank you very much.
Yeah, thank you. And I love the way it ended. She says that. And thank you, Mary, for letting us, sharing that presentation with us, because I think it's very relevant in our discussion this morning and this afternoon. And the beautiful thing she ended with is that school leaders, teachers, can deal with problems or have the capacity to solve problems we haven't even thought of. And really our work is really to ensure that capacity is there. Great. So we are closing up. We were going a little bit over time, but I hope you appreciate that we did really want to share as much information, and glad to hear from you through the chat box and other ways. Great. So what I would love us to do now is to maybe end in a kind of a last question. So we bring back the Mentimeter. So if you still have your Mentimeter set up, if you can set that back up again for us. Yeah. If you've got it there, and I have to go back to it. Hopefully you've got all the codes still with you. Yeah, so if we have the next question is, do the country examples match the experiences in your country or your reflections? So if you can answer that, the yes or no, or maybe, please do. Everybody's, yeah, we got a few coming on slowly, sharing some. Some are saying no, the examples don't match. Very interesting. Very few. Yeah, And I actually, maybe bring in this time Tina. Tina, can you kind of share with us from the Fit for School from Africa, but you also were involved a little bit in the other Safe Reopening. What are your kind of reflections on the experiences and what you've heard today?
Thank you, Belinda. Thanks for giving me a quick shot at the end of the session. I don't want to take it too long. I think we've mentioned the Fit for School Africa initiative a couple of times, especially in the last working group meeting in August. So if anyone is interested of what it is all about, you also have the opportunity to watch the recording from the last working group session in end of August via the SuSanA platform. And that's why I don't want to spend any time now explaining about what it is. It is just in a nutshell, the idea of using elements of the very successful Fit for School approaches and 3-star approaches that have been used widely in Southeast Asia and are being used, for example, by UNICEF, also in African countries, to apply those in the safe reopening and COVID response in education sectors in Africa. And as a GIZ team, we would be one of the stepping stones, together with many other organizations, and I think with all the actors in this call today, to try to provide some tools for teachers and school heads to apply the government regulations in their school context. So it's sort of the idea of providing the checklists as they have been described by Ghana and Malawi on a school level basis to give hands-on materials to teachers and school principals to safely reopen schools. That's it in a nutshell. And as I said, if you're interested in it, just contact us through the SuSanA network or this working group. And there is a recording from this summer, from the last working group meeting that explains a little bit more about the initiative.
Thanks, Tina. Thanks for sharing. I think it's a really important point, and more resources there. So then moving on to the last question, I guess, or one of the last questions, is what topics would you like to exchange more on? It's very much connected to what Tina was saying in the future. So we see monitoring is up. What other things would you like to see the WINS network, the working group, and other resources focusing on? About monitoring so far, other things? We've also got data, so it's very much aligned. Okay, then maybe we were looking at data monitoring. I'm interested to see that there wasn't actually more information on work around advocacy, financing options. I'm quite surprised not to see that as well, because one of the challenges we do see is actually access to financing and within advocacy within governments to make sure enough is being put on WINS. Hand washing practice is very good. Good. So then maybe we can go on to our very last question as we close the session. Please, can you display the last question for us? Good. So I guess it's just to get a little bit of feedback on the event. Again, this was supposed to be a side event to some of the other sort of global discussions that are going on under the International Learning Exchange. But how did you like it? And also, yeah, be honest and share. And love to hear more comments on the chat box. I want to again thank all the presenters and the supporters from Malawi, Kenya, and South Africa. I would also like to thank JMP, the team in GIZ, Bella, Lucy from the WINS Network, and of course, Christina and Linda, as well as Yana, who's been working on the back to make sure that everything is going great. But most important, I want to thank all of you who gave your time, a couple hours today, to sit and discuss with us, to share comments and reflections, to engage. It's very important. This is the time that WASH needs to not only step up, but support. Our individual and collective activities do make a difference. All of you make a difference. And the more we can connect and share, the stronger our work it will be. So again, thank you all for being part of this. And we hope we continue the conversations. There's a lot of resources. If you didn't leave here feeling this way, I hope you do feel that one objective we got is there's a lot of resources out there with the WINS Network. And please do connect with us and continue to connect and share. So thank you very much. And I love that unanimous thanks. I'm glad you found it informative. So thank you very much. And wishing you guys all a blessed day wherever you are. Thanks. Bye.